So welcome to Elder Abuse Awareness Virtual Coalition. We're back here for week 3. Joining us today is Tim Murphy, who's a supervisor of Orange County Adult Protective Services. And as you know, my sidekicks, Larry and Anne-Marie, are here for some jokes and some commentary that will make this one you will want to share with your friends and family. So welcome, Tim.
Good morning. Thank you.
Yeah. And why don't you tell us a little bit about yourself and your department before we get started?
So Adult Protective Services is part of the Orange County Department of Social Services, and we specialize in investigating and assessing issues of adult abuse and neglect, including self-neglect, throughout the county. It's a program that exists in every district, social services district through the state and in New York City. So it's a pretty dynamic place to work. It is unique because you never know what's coming in the door on any given day. So we are jacks and masters of all trades in this discipline called protective services.
You know, and Alyssa, before you go on with additional questions, you know, I want to stop and acknowledge the work that you've done in this program. You know, from the time of concept to the time of actually us now doing our 3rd video cast is unbelievable. And I know Alyssa mentioned about, you know, the role of Anne-Marie and I. You know,
waiting for that.
Yeah, well, I had to circle back on that one.
I almost stopped the video to redo it. But I'm like, I couldn't handle everyone logging back in.
No need to. But the reality is that when we came together, my name is Larry Force, and I'm a professor of psychology at Mount St. Mary and co-director of our Center on Aging and Disability Policy. And my dear friend and dear colleague is Anne-Marie Maglione, who is the director of the Orange County Office for Aging. And we have a history of working together, integrating students into, county government issue, the whole thing about the connection. I mean, I know that we're getting a lot of recognition for the relationship that we've been able to create, which is this model between county and academic institution. Mm-hmm. And when we put together a steering committee, which Tim is involved with, we knew that we had to get this information out, but we also, just based upon the nature of the synergy among the members of the steering committee, we wanted to do it with our fingerprints, which is not to take, information and make it stale and make it a talking head, but to make it interactive. And I think that's the beauty of this. And the first week, Anne-Marie and I did the overview. The second week, we had Greg Olson, who was the director of the New York State Office for Aging. And Greg was at the table based upon the connection with Anne-Marie. And that's what we're big believers in, is in connection. And then the COVID issue comes up. Now we have all this information. How are we going to get it out? We got together as a group, and yes, Alyssa, 12 days later from the point of concept, you were able to manage this and light it up. So Anne-Marie, would you like to say just a few words just before Tim, does his, question and answer and exchange?
I would love to. I'm thrilled to be part of this coalition. It's unfortunate we have to have it, but elder abuse and scams are an epidemic in not just our country, but in the world. And now you add COVID to it, where people are socially isolating, and it's just kind of a petri dish for things to happen. So, we thought about it. Do we do kind of the yearly symposium where you have 400 people and everybody talks, which is very important and necessary, but is it in this time that we're living in? And this is the way we realize that we need to reach people. And we know that education and awareness are the only thing that will eradicate this. So we got together, we got the best of the best. I would not be able to do my job without Tim Murphy in Adult Protective Service. And he's very modest, because I know he's not the only person, he's a team, and they do it as a team approach, because what they do is very, very difficult. I give him my worst cases, and thankfully he talks to me and he's really nice to me, but it's really difficult. And the level of commitment that your whole team has, Tim, is really so impressive, and I can't thank you enough. And again, I think just educating people, letting them know that, don't be embarrassed. This happens to a lot of people, and we're here to help you. So I'm happy to be here. Thanks.
Thanks, Anne Marie. That's very gracious.
Yeah. Well, Tim, nobody can argue that your department is one of the most important ones going on in Dutchess County or Orange County. And one of the things we wanted to talk about today is Orange County's response, and specifically, I think as more and more news media comes up and as people get a little bit of restlessness, what to do when we reopen, because that's going to be another change for your department as well.
So the biggest impact for us is learning how to work remotely. So Adult Protective Services here in Orange County and throughout the state is an essential service. We're probably not talked about in the same light as first responders, but we are second responders. So all of our APS staff are working remotely. Very few of us go in and out of the office during the week. So this is a big challenge to learn how to work remotely. So we are open. We are receiving new reports. We're working with people who we knew about before COVID-19 protection started. So it's a challenge to practice questioning, social distancing. You're working with impaired adults. You have a mask on, you have gloves on, you're trying, it impacts your ability to have a intimate discussion about what's going on in someone's home.
Yeah.
And social isolation and people camped out on top of each other. You have all those health issues, and you have a great deal of frustration building between family members and caregivers trying to take care of an impaired adult at arm's length. So it is a very unique challenge and proving to be somewhat stressful for the APS staff that are out there in the community doing home visits and getting people to medical appointments and helping them get food and pick up medication. It is a unique challenge.
There's a lot going on there too. And so, and one of the things, even though they might not cross paths all the time in the office, but I bet there is some relief as a caseworker to bounce an idea off somebody or know that there's somebody there, and now they're going home.
Yes.
They don't have that experience.
And there is something to be said for the professional workplace, the ride home, to process information at work with your coworkers, to decompress with the ride home and try and clear your head and listen to music or just do simple errands, and to now recreate the work environment from your home is really interesting. That you have all this background stuff that we were talking about and noise and other people in your household, and trying to stay private or focusing on what you have to do is really interesting. The stressors to the staff of not having us face-to-face, of talking on the cell phone, of emailing back and forth, that's also a challenge because you lose a lot without that face-to-face.
Yeah.
And Tim, could I ask something? Could you, because when you think about elder abuse, the typical thing that you think about is physical abuse, but that's far from the only concerns that you have or that you address as a department or as a supervisor. Could you just talk a little bit about some of the profiles, obviously not names or contact info, but some of the profiles that you address and what people can do if they're experiencing those types of things in their own life?
So being knowledgeable about the services that your county government offers, especially here in Orange County, we're rich with those services. We're rich with the connections between the department heads and the technology that we have. As Anne Marie said, the working relationship between Adult Protective Services and the Office of the Aging is outstanding. The relationship that we have within our big department at DSS in terms of Medicaid and food stamps, and that communication outstanding. Those behind the scenes staff are stepping up incredibly using technology to try and get stuff done for us. But the scenarios of impaired adults and the risks they pose are so wide-ranging, it's hard to concentrate on one. We have physical abuse, psychological, emotional abuse, family members making fun of each other, calling each other names. An impaired adult is difficult to take care of on any given day. Now it's even greater. So frustration levels are high. People don't mean to be mean-spirited, but it comes out and happens. have a dysfunction in the family that has a long life. You have isolated, impaired adults who have difficulty reading or managing their own activities of daily living or managing their finances. Financial exploitation is an extremely important topic throughout the state and nationally now. Banking systems are creating their own suspicious activity reports and getting them into us. So that's a challenge. People are very private about their financial affairs and also sometimes embarrassed if they think a family member or a close associate is stealing from them or manipulating them.
Yeah.
It's extremely unique to try and uncover that kind of information and maintain privacy and now distance. So,
Right.
it's tough.
So, you know, you had mentioned one thing about during the COVID crisis, you're managing cases that you had prior. But if somebody wanted to report a new case, are you also taking in new cases?
Sure. Yeah, we're open for business just because we're not in the office. We have a whole system in place with staff. So Monday through Friday, you know, our phone and professional staff are available to take new reports or new concerns. The two caseworkers that are working on manning the phones are extremely experienced. They've been working with the group a long time. Their fund of knowledge of county systems and resources is enormous. So they're available for phone calls, just phone interviews, and help make a decision of whether or not the circumstances that someone's concerned about is reportable as an adult abuse or neglect or self-neglect case.
Yeah. So if somebody is in Orange County and wants to reach out to you, do you want to provide that phone number or contact?
845-291-2800 during normal business hours, and there's professional staff available to speak with.
Yeah.
What happens, I mean, how do you go about as a department to be able to get the message out that people do not have to do this alone? And the other thing is the concerns about confidentiality. Somebody might see a neighbor and they feel as though the neighbor is being violated somehow. How can you assure people or continue to assure people that if they were to reach out to you, that it would be completely, extremely confidential? Maybe you could talk a little bit about that for a second.
So we use a program that is supported by the state. It's called Adult Services Automated Program. We nickname it ASAP. And the screen for the source gives us an ability to isolate the source in terms of confidentiality. It forces us to click confident source. And we can also take reports anonymously. So, you know, our decisions are based on the risk identified in the impairment of the adult as the source sees it, but the source is never revealed in a report, in an APS report. When the staff is out in the community talking about things, we never tell who called us or why or where it came from. There's a caveat to that sometimes information is so specific that only one or two people know it. So when you go to do the interview or start having the conversations, if you're the only one who knows the information, then it's kind of obvious where it comes from. But we don't deny it, and nor do we confirm it.
And let me ask you this. You talked about, and it's obvious that you and Anne Marie and your organizations have a special integrative relationship. You work hand in hand. And the fact is that not all counties can say that, you know, and you gave out a number for during during business hours. How would somebody, maybe you could address this two-part question. How would somebody reach out regarding a concern or an emergency after business hours? And maybe you could also talk about the role of the integrative role that you have with 911 and also with mobile mental health, you know, because they all weave together.
Sure. So like our relationship with the Office of the Aging, we have a very tight relationship with the Department of Mental Health, the Orange County Department of Mental Health, with the State Department of Mental Health. There is a core group of professionals that work through these systems, the health department as well, and the hospital setting. So when you get to it, there's a core group of about 20 or 25 people that we all speak with each and every month. We all understand each other's criteria and what our role is in the community. But Orange County is unique, in my opinion, because all these people have worked in this industry for a while. We know each other. We trust each other. We're able to share information and make case decisions very quickly. In the COVID-19 response, my partner Tracy and I are probably talking to one of the county hospitals 2 or 3 times a week about people who are ill, people who need to be discharged, people with special problems. But the information is quick, clean, and to the point, and it is a remarkable response. The mental health department, the same thing. The mobile mental health team and now the crisis hotline we understood that Adult Protective Services has a big need to know, and we are one of the few case management organizations that are still responding out in the community to people's homes. The other case management organizations are really kind of curtailing that in the deference of health. So it's a remarkable partnership. We work hard on maintaining it. The Adult Protective Services in Orange County hosts the Adult Protective Services Task Force, which meets every 2 months. So we are able to see each other, reaffirm those commitments, and reaffirm those lines of communication. So it is clean, and it's quick, and it is confidential. All of our systems are confidential. And so we're only sharing the information that is needed, especially in the adult protective case, for the investigation or case that we're working on.
I think one of the reasons we were able to really get this going live, aside from Elisa being incredibly smart and savvy and just working at record speed, is Tim and I have talked a long time about elder abuse awareness and what we can do. And prior to COVID, we were going to be soon to be unveiling a Gatekeeper program, which is really aimed at educating the public about it. Do you want to talk about that a little bit, Tim?
Sure. So the Gatekeeper concept, which has been sponsored by the State Office of Children's and Family Services and shared with all the districts, takes a look at the community setting of who are the gatekeepers in our community, especially the lay gatekeepers, not so much the professionals like areas on aging or hospitals or mental health systems. So those people out in the community that would be the eyes and ears of an impaired adult. So mail carriers, beauticians, barbers, wait staff, those other services that provide services to your home. It could be a plumber, electrician, housekeeping services. And it asked us as agencies, social services, adult protective, and areas on aging, to go out in the community and begin to host events and offer some education and pointers and profiles about the population, the at-risk population. So it's called gatekeeping. Here in Orange County, the APS staff and UFA staff have had several meetings throughout late 2019 into 2020 to try and really kick this off in a sustained way throughout the year. And we had the idea and desire to reach back through our Chamber of Commerce, which happens to be located in the same office buildings we're in, to use the Chamber of Commerce profile of businesses and members in their breakfast meetings to be able to kick this off and to get ourselves invited to those services that we're talking about in terms of gatekeeping. So our thought was to be able to project ourselves throughout the year into the community. OFA hosts a lot of events throughout the year, so APS made a commitment to attend each and every one of those events with staff and handouts and information sharing to give to the public to bring back. But we really wanted to reach out to those service providers, those non-traditional service providers that are not uniquely involved in these social work programs. But this virtual reality in this format helps fulfill that role for us of being able to reach back out to our community, tell them that we are here, we're open for business, we're very concerned about our community and our ability to reach the people who are most vulnerable.
Right. So it's not going to stop. We're just going to do it in a different way, and is a very nice venue for us to do that, because now more than ever, I think people need us.
And I think, and that point is so well taken. And it was really reinforced by Greg Olson, who was our guest last week, who then asked you, Anne Marie, to send this format out to all the AAAs as a model, because of the fact that although we're doing business differently, we're still doing business. We're still, and that's what really brought us to this discussion. We had all this content. We had a history of doing conferences and forums, but that option was no longer available for us at the present time. So how do we go about getting this information out? And here we are. And I think we're doing a yeoman's job of reaching families and organizations in the new world that we're living in.
So I've shared this platform with the state, with the Office of Children's and Family Services, with my colleagues down in New York City, as well as my colleagues up in Rensselaer at the state office. So they all know that it's going. They're watching the things on YouTube. And I don't know what reach they'll give it. I had a request coming back from OCFS that we look at more specifically as a county, Anne Marie, of joining NAPSA, the National Adult Protective Services Association. And that is a nationwide platform that this information you can share it on too. But for right now, it is shared with OCFS and the 5 boroughs in New York. I talked with one of my colleagues last week in New York City. Rima Rivera is a deputy commissioner for New York City HRA APS. She is responsible for all the intake and assessments. So the first 2 broadcasts were shared with New York City and specifically Rima last week. So
Nice.
the reach is going to grow really fast.
And Sharon Murray Cohen, who's part of our steering committee, is involved in this designated grant regarding elder abuse. And last week, they had a nationwide Zoom call with all of the other people that have this designation. And she shared, our platform with them.
Yeah.
So we know that it started off as a conversation between you, Tim, Anne Marie, and myself. And then we knock on the door of Alyssa Jill Williams Hudson Valley Healing Center.
And she answered.
And she answered, and she answered, and she answered. And the fact is, here we are now 3 weeks into this, and the reach is not only county, state, but also national. So, and I think, the applause should really be given to what you, Tim, how you do business, and Anne Marie, how you do business. Because I'm telling you right now, from the work that we've done, Jeffrey Kahan and I, in this national NIH grant that we got to survey AAAs, this is a very rare find. That because in government and even in nonprofit, there's always this territory that's established. And the 2 of you have been able to eliminate those territorial guidelines. And that's a real benefit and testimony to Orange County.
Yeah, we've got to get rid of the silos if we're gonna really have any kind of impact. And I think that's why I so appreciate our working relationship, because we just do it so well.
Absolutely.
We have people that call our New York Connects number and say, I'm a little concerned about my neighbor. I don't really want to get involved. Can I talk to you about it? Can you lead us? I don't want to bother Adult Protective Service if it's not a big deal. So again, we kind of do that, and then we take the temperature and we say, no, this is kind of above our pay grade. You really need to go to Adult Protective Service. They're the experts. They know how to handle things. So I always tell people, if in doubt, call us. Don't. You're not going to be the nosy neighbor. You may be saving a life.
Absolutely.
So Tim, as Alyssa brings this to close for today,
Take it, Larry.
No, it's really you. But any other summary comments as Alyssa brings this to close this session?
So I have to give a shout out to all the adult protective staff that are working here in Orange County. They are doing remarkable work under very stressful, trying circumstances. Each and every one of them has stepped up in measurable ways, covering for each other, doing double duty, working outside of their assigned duties to try and make sure that the impaired adults and the at-risk adults are seen, that there's a voice. This couldn't happen without those line staff. They're remarkable in reach.
They are.
They really are.
Alyssa's met some of them, Anne Marie sees some of them, but just, there's 22 staff here in this program, and I can't say enough about their dedication to what we're doing and trying to keep each other healthy and safe.
Yeah, yeah. And and I remember you and I had this conversation about the gatekeeper and what you were hoping the vision for the gatekeeper was, that rather than you getting a case that's now here, maybe you're going to get a case that's here and you can eradicate it before it gets to that level.
Exactly.
That's a really good point.
Yeah. We take our roles seriously, and we don't like to interfere or into someone's private life other than when we have to. I'd rather see people and families make those decisions and make those plans at a very low level, rather than have it be a created problem that it's almost unsolvable.
Yeah.
People they wait until the last minute, and it's really hard for us to fix a last minute problem.
Right.
Well, thank you so much, Tim, for being with us today. Anybody else have any last minute questions or comments?
No, thank you to Tim, Anne Marie, and as always, thank you to you, Alyssa, for moderating this.
Thank you, Larry. Thank you, Tim.
Thanks.
Thank you, Anne Marie.
Thank you.
All right, until next week, thank you so much for being part of Elder Abuse Awareness Virtual Coalition, and check in, and you can watch a recap of this video or share it with friends from our YouTube channel or our website. Thank you.